And welcome back to Good Morning Maryland at 9 o'clock on this Thursday morning. Eating disorders. It's something you may not be aware of even existing. In fact, it affects millions of men and women on a daily basis worldwide. So what can you do to better educate yourself and know and look out for your family? Dr. Stephen Crawford is here this morning from the Pratt Center talking about this because this is something that is growing in terms of knowledge, but we still have so much to learn about it from just a normal everyday level, don't we?
Yes, in terms of how do we approach these illnesses and also working towards preventing the illnesses from developing in the first place.
There are stereotypes that many of us will apply to these because we're going to instantly, if you don't know much about it, you're going to attach it to body dysmorphia, some sort of mental trigger you may have. Is it really that simple?
No, they're complicated illnesses. There's a definite biological predisposition to developing an eating disorder, and then on top of that there are all these sociocultural factors that go into play, such as the images that we see in our culture that portray what we're supposed to look like, and the ideal body image that we're supposed to achieve can impact youth as they're developing into what they feel they need to aspire to be.
Now, in terms of how many people this is affecting, it's in the millions, but the ratio is almost 10 to 1 women to men.
Definitely, although we're seeing more and more men approach treatment. In the past, this image that it's a women's illness has held back men from coming in to get care. But we are seeing more and more boys coming in as well as men. The media is putting a lot more pressure on men about their appearance now, so there's a major focus on what a man is supposed to look like. There's all these men's health magazines that show the six-packs and everything that you're supposed to have. So.
And of course, we see the models and we see all these people who are on the magazine covers, as you were just saying. What are some of the tips and some of the telltale signs that a parent might notice with a child or maybe a partner to another partner?
That somebody's struggling with the illness? Well, they start becoming increasingly focused on food and weight, so that becomes the conversation of the day. They start missing meals, so a child coming home from school says they ate at a friend's house before they came home. They tell the friend that they're going to eat dinner when they get home. So missing meals, going to the bathroom immediately after a meal, possibly to purge, is another warning sign. So the increased obsessing, it becomes a struggle around swimsuit season, going to get a bathing suit, and the fear of what that image will be like.
Now, beginning February 20th, there's going to be Eating Disorders Awareness Week. This is nationwide. Now, there are a series of events set up here in Baltimore to educate people and better train them and prepare them to recognize some of these, aren't there?
Yes. On Sunday, February 20th, we have Johanna Kendall coming in to talk about life beyond your eating disorder. These are very difficult illnesses to recover from, and sometimes people get lost in the idea that the eating disorder becomes their identity and they don't know who they would be without their illness. So that then the concept of Johanna Kendall is that there can be life beyond your eating disorder. It's a very hopeful message.
Now, behind that clock there, you see the website is eatingdisorder.org. It's not .com. It's eatingdisorder.org. Excuse me, for RSVPing to this. Doctor, thank you so much for your time today.
Thank you for having me.
We're going to have this on our website, abc2news.com. If you missed any portion of it, some important information for you here you'll want to check out, especially if this is something you think could be affecting you or a loved one. Megan?
All right, Charlie, thanks.